So what is scoliosis? Scoliosis by definition is lateral curves of the spine. Now technically any lateral curve isn't a scoliosis. It has to reach a certain degree of curvature in the spine. But it's whenever the spine, which is supposed to be straight up and down, starts to shift laterally out of its normal healthy position. The main three consequences of scoliosis are, number one, pinched nerves. So the purpose of the vertebrae in your back is to protect the nervous system that is communicating messages between your brain and your body. Those nerves come out between each of the vertebrae, and if the vertebrae are tilting out of their normal position, that can begin to pinch nerves and interrupt communication between the brain and the body. That causes malfunction and disease. Number two is that when the spine actually shifts, when you have significant scoliosis, it actually shifts enough that it can physically squeeze the internal organs like your lungs, your heart, your diaphragm, your stomach, your intestines inside of your chest cavity and actually cause problems with the normal function of those organs just because of posture changes and degeneration. And number three, and certainly the most common, is pain. Whenever the spine is shifting out of its normal position, instead of having a nice straight spine, gravity is pushing in different positions, and that's going to cause muscle problems, that's going to cause joint pain, that's going to cause arthritis, stiffness, lack of range of motion, a lot of our musculoskeletal back pain symptoms. So a lot of people want to know when they should start seeking care for their scoliosis. When is it going to affect their body in significant ways? My answer to this is, as soon as you know that you have an issue in your spine, you should get it dealt with. Whether it's mild scoliosis or whether it's severe scoliosis, the longer you leave something without an active approach to correct it, it always is going to get worse. It's like a cavity that you don't deal with right away. It's going to get worse over time. There's just no two ways about it. And so the sooner the better. Once scoliosis reaches a certain point, especially if we get degenerative changes in the joints like arthritis and disc thinning, it gets really hard to actually correct that. If caught early, and depending on the type of scoliosis, it is correctable. Can chiropractors help with scoliosis? The answer is yes, especially if caught early. Often the medical approach to scoliosis is using braces to stop it from getting worse, physical therapy, which is great, big fan of that of course, and often surgery to put rods in the spine, and we want to avoid this at all costs. You can never undo a surgery, and so we want to make sure we get this corrected as soon as we can, and so things like chiropractic and things like physical therapy would be a massive benefit, especially if caught early. So where can I find a chiropractor that can help with scoliosis? My best advice on that is to dig around people's websites. You can Google, scoliosis chiropractors in my area, near me, etc. And looking on the website to see, how much they're talking about, what their experience is with scoliosis, their knowledge with it, things that you can do at home. I think those are always good things. Looking at testimonies for people that have had scoliosis, whether it's on the website or Google reviews, and referrals from friends that have maybe dealt with something similar. Scoliosis is fairly common, and there's a good chance that you know someone who's seen a chiropractor for it.